the doctor about this technique.
Okay.
Can you help me, please? I'm about to remove this tube number 2 here. A lot of calculus. This is indication that patient have not been to a dentist and causing the gum infection, causing a lot of pain through his upper face, very painful. The tube is super erupted, as you can see, it's longer than this one. A lot of calculus here, so loose, mobile, and very swollen. And I'm going to show you how we're going to do this one painlessly for the patient. Okay, so I use 2 sets of anesthesia. First one was the septocan right here. Okay, and after you use this one, it would control the pain right away. Patient didn't have any more pain. After that, I used the high concentration epinephrine, the lidocaine, but high concentration, 1 to 150,000. So it's really calmed down him completely now. I'm going to check and show you the tube inside here. So as you can see, once I numb him, I wanted to show you, in order for you, so this is mobile. You see that's how mobile right there? So if you put the instrument in, you're going to see what exactly the dentist is talking about, deep pocket. So the pocket go really deep. You see how it's really deep there? So it's all deep down there. So then the pus coming out right there. So yeah, very unhealthy situation if we leave the tube there. So that's where it's called deep pocket. I'm going to go deep pocket in indication that the tube is ready to detach from the bone. So the way I remove this, very simple with this instrument here. So 1/4, hold tight, keep rotating vertically, and it should come nicely. Go back a little more here. One more time. Hold tight, guys. Hold tight. Don't let it drop. See, look. So you can see tremendous amount of infection. Very tremendous amount of infection. See how severe it is. You see, wonder why it hurt him so bad. Okay. The patient needs antibiotic. And sometimes if you leave it like this, the body can go away. Patient above 50 recommended prophylactically control the bacteria in his cardiovascular system, so I'll do that antibiotic for him. Really have to clean this. It's very easy to just send the patient home, but I'm going to make sure he feels tremendously healthier. So I'm going to remove some distal calculus of the excision tube. That's where it's going to heal better. We're supposed to do deep cleaning. Patient doesn't have time and financially cannot afford everything, so I want to take care of him anyway on this one. I'm going to clean him really well, remove all the granulation tissue. I'm going to irrigate this with saline solution and get rid of those infections. The reason that is don't see a lot of bleeding is because I use the 1 to 50 epinephrine lidocaine, so that's why I can control the bleeding easily now. So the next thing I do is irrigate the gum. So we're going to irrigate this, guys. I want to put this thing, stabilize the bleeding for him. I'm taking this and place directly into the gum. Yeah. Close. Completely stopped, as you can see there. Completely stopped. See, no more bleeding at all. Well controlled. That's because of anesthesia and also because of the gel that I put on there. Can you wipe, please? No pain, nothing?
Nothing.
All right.
Yeah.
Congratulations.
I did
want-
feel it take hours.
Yep. So you take your